Hi, faculty of Rush University Medical Center. My name is Amy Zwecka. I'm a neurologist, and I'm the Assistant Dean of Clerkship Education for Rush Medical College. This means that I supervise our third and fourth year medical school curriculum. This video is intended for residents and attendings who are working with and evaluating the third year clerkship students. I am happy to announce that for this year, we have developed a new evaluation form for you to use for assessment of students in the clinical environment. This was designed to align more directly with the new role-based curriculum that was implemented in 2017 and also to increase usability of the form and decrease cognitive load. I'm going to walk you through the new form and discuss some of the new features and what they mean. Please take some time to review the form on your own before you use this for your students. Remember that when you are filling out this form, your scores will be a component of the student's grade, together with all of the other evaluations the student is receiving on their clerkships. Your evaluation is only a component of their final grade, but it is used in the calculation of the final grade, along with everything else the student is required to do during the clerkships. So now I'd like to walk you through the new evaluation. All of our evaluations are housed in OASIS. As always, you will receive an email from OASIS when you have evaluations to complete. There will typically be a link to the individual evaluations for specific students, but also a link to show you all of the evaluations that you have due. So this is a preview screen, so this is not exactly what you'll see, but very, very close. When you click on the specific link, you will get a screen that shows the student's picture, the dates that they worked with you, your name, and the student's name. So scrolling down, every evaluation will ask you to attest that there is no conflict of interest in completing the evaluation. If you need to reference that policy, it is here on this link. Once you click I agree, you can move on to the next question, which is asking that you have been able to review the course objectives and assessment methodology. Again, the link is available here for you to review. And once you click agree to both of those statements, you'll be able to fill out the remainder of the evaluation. There's one other section to get more information about your experience. We are asking if you can tell us what clinical scenarios you worked with the student, as well as the amount of time you worked with the student. This information is not used in the calculation of their grades, but we are collecting this data for future iterations of the evaluation. Now into the actual meat of the evaluation. What you'll notice here is everything is divided out by the role, like we discussed before. So we'll start with the practitioner role in this first question. What you'll notice first is that the stem of the question is quite short compared to previous and is much more granular, asking about specific activities that you observe the student doing. It is now on a 5-point scale, and there is still the not observed link. If there's anything that you did not observe the student doing, you should click the not observed tab. It does not change their grade, and in fact, it's better for the student not to be graded on something that you didn't observe. So it is on a 5-point scale with anchors on 1, 3, and 5. 1 is inadequate. 3 is expected good performance, and 5 is the top 10 to 15%. If you have a student who is performing above the level of expected good performance, but is not quite hitting top 10 to 15%, then selecting 4 is the optimal choice. Same between 1 and 3. So under practitioner, we have history taking, physical mental status examination, assessment, development of diagnostic treatment plan, oral presentation, documentation, knowledge of diagnostic tests and procedures. You'll notice that there are anchors to the side. They are to help you to determine where the student falls along this level, but we have really worked to make them more tailored and specific so to help you a little bit more to make your decision on a student's performance. Next, we have the knowledge role, and under that we have medical knowledge base applied to patient care. We have the communication role, which asks about establishing collaborative relationships with patient and family, as well as engaging patients in treatment plans. Under the collaborator role, we ask about collaboration with the healthcare team. Under educator role, we ask about self-directed learning practice in the patient care setting. Under the scholar role, we ask about retrieving, appraising, and applying evidence to answer a question about patient care. Under the advocate role, we ask about recognizing and responding to a patient's health needs within the clinical environment. Under the professional role, we ask about commitment to patient care, responsibility, and accountability. Like I said, if there's something that you did not observe, please click the Not Observed button. Otherwise, use the anchors on the side to help determine where a student falls along this continuum. Under the professionalism section, we have a new section to ask about some observed behaviors. In particular, we want to know whether the student was always prompt to rounds and teaching sessions, whether they responded well to feedback, if they contributed positively to the learning environment of the team, whether they consistently displayed a training level appropriate situational awareness, and whether or not they were always behaving in a professional manner. If you click no for any of these statements, please explain in the box here. And this is incredibly helpful for us because we know that small occurrences do occur. This will not necessarily be added or change their grade in any way, but it allows us to identify areas where a student can improve on their professionalism. If you would like to be contacted by clerkship leadership to discuss the student's performance, either because it was so fantastic or if there was something identified that they can work on specifically that you don't feel like you can express in the evaluation, please feel free to click the Yes button. If you saw any superior professional behavior and you have a specific instance, please include it in this box here. So we have two more narrative summary questions asking about the student's strengths and what additional skills the student would benefit from developing. And these are required. Please be mindful and think about specific instances and examples of how the student can improve. This is a summative assessment, and ideally, this shouldn't be something that the student is unaware of, but rather something that the student has been working on over the course of their clerkship. Finally, there is a safe haven box. This information will be withheld from the clerkship grade report or the dean's letter, so if there's something else that you feel needs to be mentioned regarding the student's performance, you can write it here. I would say to refrain from putting positive things here because it means that we can't include it in the report that goes out from our institution. Finally, you just sign down here with your initials and submit, and you're all done. So that concludes our introduction to the new student performance evaluation. If you have any questions, please feel free to reach out to your department's clerkship leadership or to me so we can properly address your issues. Thank you so much for your time and commitment that you contribute to the development and assessment of our medical students. We appreciate you so much. Have a great day.